Ms. Tolliver. How are you today?
Good, how are you?
Good, thank you for asking. Well, we have a lot planned for today, so let me just give you a basic rundown of today's agenda before we do anything. First, I'd like to assess your current understanding of certain dental concepts like biofilm or plaque, and its effects on oral health and diseases that it could lead to. And from here, I could further educate you on any areas that you might have some confusion on. Also today, we are going to use what is known as a disclosing agent to identify how adequately you are brushing and flossing, along with some simple demonstrations so that way you will leave today with a nice clean smile. Now, before we get started, do you have any questions?
No, we can go ahead and get started.
Alright, well in that case, let's go ahead and get started. I'd first like to ask you what you know about biofilm, which you may have also seen as the term plaque.
I guess biofilm is kind of like the whitish stuff that sticks to your teeth.
Correct. Biofilm, to be more specific, is a layer of acidogenic bacteria and other microorganisms that sticks onto the tooth surface, especially towards the gum line, which is also known as the gingival margin. Do you have any thoughts, Ms. Tolliver, as to how biofilm develops in a person's mouth and what effects biofilm has in the mouth?
Well, I guess it could be from not brushing your teeth and eating too much like bad food or whatever, just eating food in general, and it can cause cavities.
Yeah, very good. Biofilm does indeed play a role in the caries production process or the production of cavities and tooth decay. It can also progress further into other diseases, which we will discuss momentarily. Here's a wonderful visual aid of the caries process to look at while I explain. As you can see here, our body creates a natural substance known as acquired pellicle, which is a protein layer that forms from our saliva, and it's natural, and it develops and sticks onto our teeth within minutes of brushing. The acquired pellicle is great in a variety of ways. It lubricates our teeth, it acts like a shield against acids that could damage our teeth. However, it also acts like a double-sided sticky tape on the tooth surface, which is perfect for bacteria to stick to. Do you have any questions so far?
No, I don't have any questions.
Alright, well then we can move on. So we know how the biofilm sticks to the acquired pellicle layer on teeth, but how does biofilm actually lead to dental caries? And as you can see, if you follow along with the chart, the acidogenic bacteria combined with the fermentable carbohydrates that we eat every day, like breads and pastas and sugary candy, for example, is going to produce an acid that works to dissolve the minerals in our teeth. And also, the more often we have these fermentable carbohydrates, there's going to be an increase in acid production as well. So if you're going to enjoy a can of soda here and there, it's best to do it with a meal rather than just sipping on it progressively throughout the entire day. This demineralization can be seen in the mouth as whiter discolorations on the tooth surface, but not to worry, because at this point in the caries progress, we can still remineralize the tooth through the use of fluoridated toothpaste, and also it can be found in water, and saliva is going to transport the fluoride to the different tooth surfaces, as well as through routine oral self-care. So, do you have any questions so far about any of this information?
No, we can keep going along. I don't have any questions.
Alright, well, as I had mentioned earlier, biofilm can also lead to a variety of other diseases as well, and not just tooth decay. So I'm going to get into a little detail about how it does that now. So, as the population of bacteria increases and more microorganisms grow and evolve, they're going to develop into more damaging types. And it only takes as little as 2 weeks of time for us to be able to see our own body responding to this bacteria buildup. The gums, also known as the gingival tissues, will appear edematous and erythematous, meaning that they will be inflamed and red due to swelling. And this is what we know as gingivitis. Do you have any questions about gingivitis?
No, I guess that's what really happens at this point. Like, how do you cure gingivitis?
Well, at this point, through the continuation of proper oral self-care, gingivitis is reversible. However, with even more discontinued oral self-care, gingivitis will progress further into a disease known as periodontitis. Here I have a visual you can look at of the oral cavity and the relation of the teeth and the surrounding bone and the gums. And we can look, and I like to use the example of a turtleneck sweater. You picture the way it hugs your neck, but you can still fit under there. And that's the same with the tooth sitting in the gums. We can see here that we can pull the gums back slightly, and biofilm can reach under there. Even though it typically sits snug against the tooth, there's still room for the biofilm. And as it works its way subgingival subgingivally or, below the gums, it's going to start to invade the underlying supporting structures or the periodontal structures of our teeth that help to hold our teeth in place. Some of these structures that are invaded or destroyed include what is known as cementum, which is a layer of the tooth that protects the root, as well as the alveolar bone, which is the bone that actually holds all of the teeth in place, and very important periodontal ligaments that act kind of like rubber bands and attach the tooth to the bone. Now, with the excess amounts of bone loss and attachment loss, bacteria that floats between the gingiva and the tooth will reach even further into pockets between the tooth and the gum, and eventually it could work its way into our bloodstream and even contribute to different diseases of the body. Again, our body has natural mechanisms to fight periodontitis, as one can see through inflammation of the gums, but if a person were to reach this point, it would be irreversible. So you're doing a really great job so far keeping up with all the information I'm giving you, and I know it could be quite a lot of information to take in. Do you feel there's any concepts that need to be clarified further?
No, I understand everything. I just never really understood and knew why it was so important to brush your teeth and floss all the time. But there's a lot of bad things that can happen if you don't.
Exactly, and it could be a little intimidating to think about, but that is all the more reason to have proper oral self-care. Now that you have a great understanding of these conditions, let's take a look in your mouth and identify if there are any problematic areas. Here for you is a pre-procedural rinse, and you just swish it in your mouth for about 30 seconds, and then you can spit it right back into that berry cup. All right, Miss Taliber, so here's a hand mirror, so that way we can take a look together. I'm just gonna break open this clean mirror for us. All right, so we're gonna look to see if there's any areas of redness or inflammation, as well if there's any biofilm buildup or any other suspicious areas that we can see. And it looks to me like everything is great. There's no areas of redness or inflammation, and your gums are nice and tight, and the contact areas of the teeth, as they should be. So what is it that you do every day for your oral self-care routine?
Well, I brush my teeth every morning and night, and on the weekdays, a couple times a week, I'll floss my teeth with those little picks.
Okay, well, that does sound like you were doing a great job, but let's take a further look with the use of a disclosing agent to see if there's any areas we need to improve. Alright, Reagan, so now we are going to apply the disclosing agent, and it is a hot pink color, and it's going to stain all of the biofilms. That way we can see areas where you might be missing when you're brushing. Because of that, we don't want your lips to turn bright pink. I'm going to ask that you apply some of this Vaseline on your lips first, and had you had any restorations in your mouth, we would apply it to those areas as well, but you don't, so you don't have to worry about that. And I'm just going to apply it with a Q-tip. It's not going to hurt or be any discomfort. And it has kind of a subtle sweet taste, but for the most part you can't really taste it. And whenever you're done with that, you can just set that down on this table. Thank you. Alrighty. Okay, so I need you to open for me. Alrighty, so now that we have this painted all over your teeth, I'm going to ask that you take this water and you can swish around with it real good and then spit it back right into that cup if you'd like. Okay, so now, Reagan, you can take the hand mirror and we'll look and see what areas the disclosant shows us. Alright, so we're going to look for any bright pink areas, and we can see that you're doing a great job brushing the facial and the lingual surfaces, which are the main surfaces of your teeth. We may need to focus just a little bit more on the interproximals, and those are the areas that we reach with flossing because it's in between surfaces of the teeth. And we also want to focus just slightly more along the gum line. So first, I'll demonstrate flossing for you. You want to be flossing every day, brushing twice a day, in the morning, at night, and flossing as well. We're going to start, you want about like 15 inches of floss. I always say it's safe to go with your arm length as a good measurement. And you're going to wrap the floss between your middle fingers, and then you're going to pinch with your pointer and your thumb finger, leaving about a ½ inch of space to slide in between your teeth. Now I'm going to ask that you pick up the mirror again, so that way you can see while I actually floss in your mouth for you. Right, so we're going to take the floss that we have here, and if you open and you can look in the mirror to see, I'll start with the front tooth. we're going to take it and kind of make it diagonal to the contact point where the teeth touch and do a gentle seesawing motion to work it in between that area. Then we're going to take it and curve it in a C shape against the tooth so it hugs the tooth and push it down into the gingival margin, because remember it's kind of like a turtleneck sweater and biofilm will form there. Then we're just going to scrape it slowly up against the tooth, pulling all of the biofilm out. Now before we take it out of the contact, we can actually work on the other side of the tooth as well. So again, go below the gingival margin, hug it against the tooth so it makes a C shape, and pull it up against the tooth. Okay, so you're going to do the same exact thing when you're working in the back teeth as the front. You're just going to slide it through and seesaw motion. The only difference is when you're working in the lower jaw, you're going to push down with your pointers. So you could open for me and I'll demonstrate. You can look in the mirror. So you just want to push down with your pointers like this. And when you're working in the upper, you're going to push up with your thumbs like that.
Okay, so you're going to do this, and then...
Right, you want to wrap it around your middle fingers.
Oh, middle fingers. Okay. And then about that, well, do you need more?
No, you want just like a ½ inch of working space.
Okay,
and then hold it with your pointer and your thumb, pinch it. Correct. And then work it into the between the contact and a seesaw motion, and then hug it up against the tooth. Good job. And then switch to the other side.
And then like here?
And then for your top teeth, you push up with your thumbs. Good job. Alright, so now that you know how to floss, and you did a wonderful job with that, we're going to go over how to brush the rest of the surfaces of your teeth. So, first off, I know that there's a lot of brushes out there to choose from. What I'm going to recommend is a soft bristled, nylon bristled toothbrush, and you want a smaller toothbrush. First, we're going to do what is known as the sulcular or the Bass method. And this method of toothbrushing is going to clean up in the gingival sulcus, because remember how I said it's kind of like a turtleneck sweater up against the teeth. So this will remove any biofilm that's in that area. Now, I always recommend when brushing to stay consistent and have a routine. So starting in, for example, the top right, working to the top left, and then bottom right to bottom left. Something along those lines. Whatever works for you. So, if you look in the mirror, we're going to take the closest row of bristles that are to the teeth, and we're going to take them and angle them first towards the gums, and then angle them at what is actually a 45-degree angle towards the tooth and the gingival sulcus, which is the turtleneck sweater. Then we're going to push so those bristles go up into the gum line. Can you feel that? Alright, and then you're going to brush back and forth about 8 to 10 vibrations, focusing on about 1 to 3 teeth at a time, and then you're going to overlap and continue in the next area. You're going to do that for all of the tooth surfaces in the same horizontal stroking. Besides the anterior teeth, which are your front teeth, the lingual surfaces, which are the side that's facing your tongue, we're going to do it vertically. So you do that. So why don't you give it a try now, and I'll hold the mirror for you.
Okay. So I'm going to take a gun.
Yes, you're going to make it towards the gums, then angle it so that way those bristles go in the gums.
And rush.
Alright, good. So now we'll go on to the next method, and you can grab the mirror again for me. So now that we have the gum lines and underneath the gum lines clean, we're going to work to get the bulk of the tooth clean. And this is with what is known as the rolling method. So for this method, again, we're going to start, I'll start down here. Again, we're going to take the bristles and position them so that way they're facing the gums, and then lightly on the gums as well as the tooth surface, we're going to roll the brush so that way it cleans that area, and we do that about 5 to 10 times per area, and then we overlap to the next area. Now, a lot of people tend to use a heavy pressure when they brush, but really you don't need a heavy pressure at all. You just need a nice light pressure, and you'll know if you're doing too much because you'll see the bristles bend. So why don't you give that a try now? Alright, so in that area, correct. You know, and you do that about 5 times, then you overlap and work on the next area. Your anterior teeth or your front teeth that face your lips, for there you can do the horizontal as well, but again, for this part you just kind of do this, and that might tickle a little, but you know, you just kind of do that nice rolling motion. So why don't you try that in your front teeth? But we still need to clean the chewing surfaces, also known as the occlusal or incisal surfaces. So for that, you can look with the mirror. We're just going to take the brush and vibrate it back and forth as such. Again, focusing on 1 to 3 teeth before working on the next area. The same for the front teeth. And you're just going to do that all around. So why don't you give that a try. You want to make sure you do it with still a light pressure, but firm enough that you're getting into like the deep valleys and pits on that surface of the tooth. Alright, excellent. So with all of those techniques combined, you will have a nice clean smile. So now that your teeth are nice and clean, we want to focus on some other areas of your mouth as well where biofilm can build up. For example, on the insides of the cheeks and lips as well as the tongue. So first I'll show you, you can use the mirror again. For the inside of the cheeks, we just want to use a nice light sweeping motion like this, and it's just going to make them so much cleaner. And again, you're going to go through in the lips and kind of do a nice light sweeping motion, as well as on the roof of your mouth. So why don't you give that a try? I'd like you to imagine like a zoomed in version of your tongue. All of your taste buds kind of look like mushrooms, and the mushroom cap, underneath it is going to hold biofilm and bacteria, and that can cause bad breath. So that's one of the main reasons we want to get rid of the biofilm on your tongue, as well as it can transfer to your teeth. And we know what can happen if it gets on your teeth. So I'll show you. If you stick your tongue out, we just push far back, and I'm actually going to have you hold this napkin because stuff will come off your tongue, so if you hold that there. So we push far back, and then we just pull it forward, and it gets all of that stuff off of your tongue. And again, and you want to do all of the surfaces, or get the entire surface of your tongue, then far back. So why don't you give that a try now? And I'll hold these things for you. Good job. All right, Ms. Tolliver, you did a great job today with all of the information that was thrown your way. So I would like to ask if we could recap on a couple things just to make sure that you really understand it. So tell me, what are some things you learned today about biofilm?
Well, biofilm can stick to the acquired pellicle.
Correct.
And if it mixes with certain types of food like pasta, it can attack your teeth. And it'll create an acid to attack your teeth.
That is very true, and this is what leads to tooth decay. Do you know, again, what I had said about gingivitis and periodontitis, kind of what those look like in your mouth?
Well, they can irritate my gums and my teeth, and I can also have bone loss.
Correct. With periodontitis, you'll lose bone, and eventually it could lead to tooth loss as well. So it seems like you have a great handle on that information. Now, recapping on toothbrushing and flossing. So how often do we want to brush and floss?
Well, you want to do it twice a day, in the morning and then at night.
Correct. And do you remember the different brushing methods we went over?
Well, brushing up at your gums to make sure you get everything, and
Correct,
then
underneath the gums.
And then also for side cheeks, and then in your mouth and on top of your roof of your mouth.
Right. As well as there's the rolling method that gets the main surface of the tooth, and then you want to brush the occlusal surface as well, the chewing surface. I mean, you did a great job today, and again, you have that stuff to take home with you, and you have a nice pearly white smile now.
Thank you.
So thank you for coming in today, and you're a great patient.
Thank you.